Well, good afternoon, everyone, and thank you so much for joining our 10th Gateway College Lecture Series. We greatly appreciate your support and interest in contributing to the knowledge economy. So my name is Bonnie Bainham, and I'm the project coordinator for Be Well, Work Well with Gateway Center of Excellence in Rural Health. Gateway is located in the lovely Goderich, Ontario, and is the only rural research institute in Canada. It is governed by community-based volunteers who aim to advance rural health, teaching, and research across Huron, Perth, Grey, and Bruce counties. Our mission is to improve the health and quality of life of rural residents through research, education, and communication. A long time ago, it seems, in February of 2021, Gateway launched its first virtual lecture series. With social isolation being at the top of mind as COVID-19 restrictions continue to heighten, there was no better time to launch this initiative. Through these lecture series, our hope is to cultivate a culture of rural health knowledge and innovation while virtually connecting communities to reduce social isolation. Today, it's my pleasure to introduce to you Dr. Feng Chang, who's the chair of the board at Gateway and also the research chair of rural pharmacy. Today, Dr. Chang will launch a discussion about rural vaccine confidence. So thank you so much for joining us today, and I will pass it over to Dr. Chang. Thank you very much.
Thank you, Bonnie. We'll go back to sharing my screen. Okay, so hopefully you can all see that okay. So how the session will go is that I will start off by doing an overview of what our team does and introduce this project. And we actually have two great panelists with us. I'll introduce them in a bit. And then we will go to your questions after this. So if you have any questions, feel free to pop it into the Q&A and we will be sure to get to them after the talk. So thank you to the seminar organizers and thank you to Bonnie. I was one of the earlier research chairs to become affiliated with Gateway. So thanks to the vision of the Gateway founders and to leadership like Dr. Waite at the School of Pharmacy, I'm very fortunate to have had these years of experience working with Gateway. And today I've been asked to talk a little bit about our team's work in the region and specifically the latest project related to vaccine confidence. So my team is made up of research staff, graduate students, undergraduate students, and students from pharmacy, but as well as students from other areas of study. So normally we would work with other faculty members from many different fields and frontline clinicians, community organizations like Gateway, but also other types of profit and nonprofit organizations and community members at large. So our work tends to focus on one of three areas: rural health, health of older people, as well as the way pharmacists work and provide care. So in recent years, a lot of this clinical work has focused on chronic pain and the opioid use and opioid use disorder. Here, I'll briefly mention a few examples of our work. So Lonely No More is one example that started off as a university research initiative back in 2018. So this was supported by a grant from the Ministry of Health, Ministry of Seniors, sorry, and Accessibility. So right from the beginning, Lonely No More has been shown to be an effective virtual outreach model, and it's really coming very handy during the pandemic times. So it basically serves those who self-identify with the negative impacts of social isolation. So it uses strategies like integrated peer support, coaching, conversations, and system navigation. And the idea is really to promote the growth of new networks as well as community engagement. So this quote here, I think, illustrates it quite well. This is from a participant. It says, I thought it was a really unique program that was really focusing on peer-to-peer support, which is amazing. Leads to that level of connectivity and compassion and a sense of belonging that we're looking for. So Gateway is currently using it to serve rural older adults in 7 different counties. And you can see with these latest 2021 numbers, the program has really grown in diversity as well as reach. So, and this all pretty much organically happened through the efforts of the participants and volunteers. Healthy Harvest is a project that we did that was meant to help us better understand opioid use among rural youth. So we had worked with over 20 individuals in the region who routinely work with younger adults and provided their informed opinions through a series of targeted interviews to help identify gaps and any potential solutions. This picture is a clip from a video that we did for the National Institute of Human Development Child and Youth Health video competition where this project was entered. So we should learn of the results very soon later in January. This paper called Perceived Barriers and Facilitators to Providing Methadone Maintenance Treatment Among Rural Community Pharmacists in Southwestern Ontario. So this is a project done with Huron and Perth community pharmacists because at the time methadone access was identified as among the most urgently needed new services in the region based on a report from Social Research and Planning Council. So this work was carried out by a Gateway student who was a local resident and later became a pharmacy student as well and published in the Journal of Rural Health. The reason we did a lot of work in the area of opioid use and opioid use disorder is really because of the opioid crisis. And I'm sure you've heard a lot about this in the media already in both Canada and the United States, rural communities have actually been significantly impacted by this. And these few examples here just show that the evidence shows greater odds of prescription opioid misuse as well as hospitalization rates. So there are, as with, this is a complex matter, of course, and there are many factors involved. These are a few that have been reported. For example, high-risk jobs and low availability of substance use disorder services and geographic isolation, etc. So I'm not going to go into too much detail here, but obviously better understanding and exploring our communities will help us develop community-centered solutions. So I can certainly talk more about this, but I haven't forgotten that we're supposed to be here talking about the vaccine confidence. So how these two things became highly relevant for us is that the opioid crisis worsened in the context of the pandemic, and its impact has been deeply felt. Since the onset of the COVID-19 pandemic, what we have seen is a substantial increase in opioid-related harms and deaths. For example, the rates of EMS services for suspected opioid overdoses increased by 60% in Ontario. And as another example, between April and June of last year, over 1,700 apparent opioid-related deaths were recorded. And compared to the same time period in 2019, this is a 66% increase. So looking at this data shows that Ontario is one of the key provinces impacted by the opioid crisis, alongside of Alberta and British Columbia. So this has resulted in an increase in hospitalizations, along with other burdens on the healthcare system, and not to mention on the communities and individuals and families themselves. Impact is not just reflected in hospitalization and death, it's also reflected in other ways. For example, here it shows that needle exchange dropped about almost 80% during this time. And that's a tool used in harm reduction. So this is from September of last year. The Ontario's COVID-19 advisory group, known as the Science Table, published a paper called The Impact of the COVID-19 Pandemic and Opioid-Related Harm in Ontario. And it notes that in particular, the following subgroups have been especially impacted. And you can see that people in rural communities belong to one of these subgroups. So this brings us to take a look at how we can help with supporting pandemic efforts in the community besides focusing on the opioid crisis. Vaccinations is one of the key strategies that public health advocates and has been a fundamental tool for preventing infectious diseases since the late 1700s. So we want to better understand about vaccine use and vaccine confidence in the region. And this brings us to the current project. So vaccine confidence is broadly speaking defined as confidence in the safety and efficacy of vaccines themselves, as well as the healthcare system and professionals giving you the vaccines, and trust in the policymakers making decisions surrounding the use of these vaccines. On the other hand, vaccine hesitancy is not quite so black and white. Okay? It's very important to remember that it's actually a spectrum of different behaviors. It's more like a continuum. People are different. They live with different circumstances, different backgrounds, have different health histories, and influenced by personal history, as well as past experiences and their peer groups. So people end up having their own reasons for taking or not taking a specific medication or treatment. So that has always been existing in healthcare, but it's really become magnified and perhaps somewhat lost in the understanding with this public discourse with vaccination policies. So this continuum of vaccine acceptance shows that there are people who will definitely, so to the left side, there are people who will definitely refuse all types of vaccines. Then as you move towards the right, there are people who will refuse them, but with some doubt. And then people who will delay getting them or decide to get some vaccines, but not others. People who accept vaccines, but also have some doubt and feel a little bit unsure. And then at the very right side, you have people who strongly believe in vaccines and will accept all types. Since the vaccine came onto the market, what the data showed was that Canada has high overall vaccination rates, but there are pockets of hesitancy that appeared to continue the spread of the virus. So this is a quote that says, less dense, less urban areas were relatively spared in this pandemic. But I think we're starting to see the non-urban wave of COVID starting. This is a quote from a Southwestern Ontario infectious diseases physician, actually based in Hamilton, Ontario. And this is quoted in a news report called Canada's New COVID-19 Epicenters Are More Remote, Less Vaccinated, and Less Resourced, from a Reuters article in November of 2021, so just about 2 months ago. And this article discussed the onset of COVID-19 in Canada's remote and rural areas. This survey by the Canadian Hub for Applied and Social Research, this was based on 2021 data, showed that in Saskatchewan, over 80% of urban residents expressed a willingness to receive the COVID-19 vaccine versus just above 60% of rural residents. And looking at our own region, you kind of see similarly, we're below the provincial average. And this is despite our area being disproportionately older in age. So Grey Bruce actually has the lowest 2012 plus vaccination rates in the province. And some of this is driven by younger age groups where the difference is at the greatest, but older age groups fall behind as well. So what causes vaccine hesitancy? A lot has been studied in this area, and as you can imagine, many reasons and different factors will come into play, and some reasons will apply to certain individuals while others will not. And so going back to that spectrum we were looking at earlier, different factors will speak more or less to different populations along that spectrum. A common one is safety concerns, and this is one that's being frequently reflected in our conversations as well. So this often involves concerns surrounding, for example, long-term safety and the effectiveness of the vaccine. So unsure about, how long this will last. Is this going to cause me problems down the road? Some people are concerned about how quickly the vaccines got developed, and some are also concerned about the technology used to develop the vaccines. And of course, people are, with any medication, probably some people are concerned about the risk of adverse effects as well, especially if they already know someone who expressed that they had negative reactions to the vaccine. Misinformation plays a role too. And in this day and age, misinformation is quite easy to spread by technology. It may not have been created or shared with the intent to do harm, and sometimes quite the opposite. The person sharing might really care about you and really want you to be aware. Nonetheless, it can still be misleading, and it can create a lot of confusion for the person getting different sources, different information from different sources. And this can lead to a difficulty in trusting, well, who should I listen to, right? What's a trustworthy information source? And leading to skepticism. Vaccine complacency refers to cases where the person feels the risk may be low for themselves. So for example, if they feel they are young, very healthy, right? I work out, I take care of myself, I eat well, I have a strong immune response, so I'm not too worried about this disease. It could also be cases where there are competing priorities with school or work, for example, and the person doesn't want to jeopardize what they're currently doing. Like, for example, their opportunities, their other opportunities, or maybe they don't perceive that they currently have enough bandwidth to take this on as well, right? To consider booking to consider looking into the vaccinations and reading up on it and booking the appointment, etc. Maybe they're just feeling too burned out at the moment. Vaccinations can also appear unnecessary because people think I already take enough precautions. For example, I stay home mostly, right? I don't go hang out with groups of people. I'm already wearing a mask when I go out. So those kind of thoughts can lead to people thinking that I have enough protection without the vaccine. The other factor that comes into play is convenience. And this is actually quite a practical consideration. So this could be reasons like geographical access. So being too far, too difficult to get out into the snow, drive down to wherever the vaccination center is. Conflicts with personal and work schedules, having hectic days, making it difficult to find a time, to pre-book a time to go and get the vaccination. Having available to them accessible healthcare information. So this could be healthcare information that they can read and understand, or maybe it's information that can help them overcome language barriers. And as well as the appeal of immunization or service providers. And this is where our program, this Reach in Rural project, can help. This is actually modeled after the Lonely No More program I mentioned earlier for isolated older adults. It uses the principles of being supportive, where the groups welcome open discussion, and provide peer support and system navigation to all community members who are interested. It's confidential, so the open discussion is in a safe and confidential space. And it is inclusive, which means that community members are welcome to discuss any of the evolving hesitancy factors that we talked about, or even those that we haven't talked about. Sorry. And my computers are a little slow when I advance the slides, so I pressed on it one too many times. So what we have done so far in this project, so initial training, and we always offer a practical session as a part of this initial training. This initial training took place for interested community volunteers, meant to support the peer discussions. This took place late last year, and then a toolkit was also developed at the same time with a collection of resources, and it's also been shared with some other communities who have expressed an interest. Circles, we offered 6 sessions, ran in the first 30 days of running the program, and they're basically 3 to 4 offerings per month, as well as flexible sessions as opportunities arise. And looking ahead, we will be planning for the second round of training plus additional discussion circles soon, and information for how to get involved will be put up at the end of this conversation for those of you who may be interested. Other components of the project include these community seminars. So we delivered one last year with a panel discussion with Andrew Williams and Kristen Watt. Both are local residents and well experienced with the topic of vaccine confidence. And then this is our second one, and we will be inviting insight also from Dr. Waite from the University of Waterloo School of Pharmacy. As a part of our outreach since last October, we have contacted over 50 health care facilities, including pharmacies and family health teams in the region, posted articles in newspapers, and completed a radio spot. We have reached out to community centers, school boards, social media, using tools like Twitter and Facebook, as well as reaching out to libraries, churches, and service clubs. So actually, I'm going to stop here and turn it over to Dan. So Dan is our pharmacy student, was our pharmacy co-op student with us last term. And he actually coordinated a lot of this community outreach and getting the word out, and spoke to a lot of individuals in the region. So he will go into a little bit more the details of the challenges he's seeing with this project, what types of messages we're hearing from the community members, and also the impact thus far. So Dan, I'll turn it over to you.
Right, yeah, so as Dr. Chang said, I've been doing a lot of work on this project over the past little while, and we've found out a lot. There's been also a lot of challenges in continuing on with the project. As you can imagine, the topic of vaccines for someone that doesn't want to get one is going to be pretty fiery. There's been a lot of debate in the community. They felt hostility from vaccinated people and from the media and from all sorts of sources. So engaging them can be very difficult. So you have to be very particular with your use of language, how you approach it, because you don't want to be like overbearing, intrusive, and pressuring. They've got that from their neighbors, they've got that from the media, they got that from the government already. So you kind of have to frame it as that open discussion. And that's the most important thing, framing your intentions as, hey, I'm not trying to pressure you into getting vaccinated. I'm just here to talk about it. And the other part about that is also, addressing their concerns head on. A lot of the time, especially in media that they read, it feels like they have a an issue that they're worried about, and it's kind of just hand waved. And the most important thing there is to kind of delve into it, give them a clear picture of, what's going on there. And the other thing here is, passports were kind of a wedge. So when the vaccine passports came in September, we saw about 10 to 15% increase in first dose rates in the area. And those are people that were kind of convinced by the passport. But for other people, it only made them more entrenched in their desire not to get the vaccine because they felt pressured into doing it. And then there's some other, things you have to worry about in terms of running the program. There's can be tech difficulties. We live in rural areas with, not always the best internet, as I'm sure many of you are aware. And even just reaching people that don't have access to internet or don't regularly, go out in the community and find out about the program, for instance. So we ended up offering, you can also do it over the phone as well. So if you don't have internet, you can do a landline, but there are still gaps. Some communities just won't hear about the project because we didn't reach them in our outreach, basically. And then there's problems with community confidence as well. So initially, when you approach certain members of the community, let's say a service club, there might be a bit of hesitance to kind of fully get on board because you're coming from outside. You're saying, "Hey, we're going to do this project. Can you help us?" Well, they don't know anything really about you, or they might know a bit, but they might be a little bit hesitant to get fully on board. But as time goes on and you start running more of these sessions, we saw kind of an increase in the community getting behind the program, willing to advertise it, willing to help out with running it. And then there's also problems with volunteer confidence. So when you get a volunteer, you're talking about vaccines, which is a medical topic. That can be something that not everyone has a ton of experience with. So it's really important that in the training, they have resources they can refer to. They have kind of a clear picture of vaccination and kind of some underlying knowledge so that when they're approached with a question in one of these sessions, they aren't blindsided by it. And then there'll be continual support. So the purpose of the toolkit basically was to continually provide resources to these volunteers so that they can always be up to date on the newest information regarding vaccination. And then there was also a problem with registration. So we engaged a lot of vaccine hesitant individuals. Sometimes they register, sometimes they don't show up, but that's just a problem with any program at all. Sometimes people will register and not show, but we have had pretty good uptake so far otherwise. So with regards to that, with the impact of the program, if we go on to the next slide. The attendees actually, they reported feeling heard and respected. One attendee said to me that me reaching out had been a blessing because they hadn't had the opportunity to talk about some of these issues that they've been on their mind. And, whether that's because they don't have a family doctor, haven't been in to talk to someone, or they just feel that it's such a hostile situation, they don't really want to deal with it. Having that circle where there's an open discussion and their concerns aren't looked down upon, they aren't waved over, and they aren't demeaned for having concerns was really valuable for a lot of the people that came. And, people ask for more resources. They say, "Oh, I heard about, fertility concerns with the vaccine. What can you send me on that?" And you can connect them with good quality resources that they can understand rather than, a news article. They can go to something that, answers their questions a bit more thoroughly and a bit more rationally. And for the volunteers, it provides them with kind of leadership opportunities. They can get engaged in improving vaccine confidence. Some of the volunteers use these skills outside of the sessions. They told me that they were talking to their neighbors about it. They were talking with people on Facebook about it, or people that they knew about that were having questions about vaccination. They are now empowered to provide that information. And then the toolkit as well, the content was informed by the volunteers, and that content can be useful too. We can disseminate that to other people that have questions about vaccination. It's a nice, good resource basically for any questions people have about vaccines. So it was good to have that there available too for individuals. But one thing on the next slide I'd like to get into is kind of what we've heard from vaccine hesitant individuals. And there's three really big ones that I've noticed through every conversation we've had. Number one is mandates. And there's no getting around this. If you're an unvaccinated individual, you can't go to a restaurant, you can't go see your kids' hockey game, you may have lost your job. These things are real realities for people. And whether or not you are pro or against the mandates, it's going to come up when you're having a discussion with someone who's unvaccinated. And it's really key to have kind of a sensitive approach to that, because these people have lost things because of the mandates. And And some cases that made them get vaccinated. In other cases, they are completely resistant to even talking about it. So when I framed it in these conversations, you say, for me personally, right, I can sympathize with them, but unfortunately, we can't change anything about the mandates. So the goal there is to kind of shift the discussion from the mandates and say, what about the vaccine on like a medical side? The efficacy and safety is a concern for you, because unfortunately, I'm not Doug Ford, and I can't do anything to help them in that regard. So onto the safety concerns, the big one is myocarditis. That's the one everyone's been hearing about for months and months and months. And every time people bring this up. So the important thing there is to kind of put it into perspective. People hear rare side effect, but what does a rare side effect mean? I mean, maybe that rare side effect will affect them. So you have to kind of put it into context. And I'm sure a lot of people have seen this, that the incidence of myocarditis is greater if you get COVID-19 than if you get the vaccine. That's the kind of thing you have to do to put it into context. Because if you say, oh, it's 1 in a million or something like that, well, what if they're the 1 in a million? Is that going to put them at ease? But if you say that getting COVID-19 has about 15 times the higher risk, then the vaccine is the lesser then of the risk. So when you have these conversations with people about safety in this way, I think a lot of them find it unique, more novel to them, this discussion, because from the news media, you read an article about, oh, myocarditis, they'll have a quote that says, oh, it's a rare side effect, don't worry about it. And for people that are vaccine hesitant, that are unsure about vaccines, that's not exactly reassuring, because they might have distrust in the media already, or distrust in a public health official. So by going kind of into it on a deep level with them and addressing, recognizing that it is a concern, that it is a real thing, but mentioning that it is still better to get the vaccine than to get COVID-19 while you're unvaccinated, then that's a big part of it. And then the other safety concerns would be an underreporting of side effects. So some people feel like it's being covered up. You can point to Health Canada data and talk about what surveillance entails from Health Canada. But it's a concern that a lot of people have. So you have to kind of explain, how is Health Canada actually monitoring this? How do we know that they're going to catch a side effect if there's a side effect to a vaccine? And pointing out that myocarditis and clotting with the AstraZeneca vaccines was actually identified by Health Canada, and other health organizations can actually improve the confidence in that, because they actually are powered to be able to determine if there's a side effect. And the big one as well is, how long does immunity last? This is not just among unvaccinated people. People that showed up to the session, some had 2 doses, and they're wondering, what's the point of getting a booster if my vaccine doesn't work anymore? And that's a big misconception, that the vaccine doesn't work anymore as well. There's 2 different things we talk about: serious outcomes and symptomatic infection. And from all data, the efficacy against serious outcomes is still holding very strong. And a lot of people were put at ease by that knowledge, because they don't feel like, for someone that's saying, oh, I've had my 2 doses and now I have to get another one, like they feel like they're going to have to do it for their entire life. And they don't feel very confident in the vaccines anymore. They feel like it's not being effective. But letting them know that they do still have great protection with the 2 doses, and just that booster will bump it up a little bit more even, is kind of reassuring for a lot of people. But yeah, I think that's the main things that we've heard for sure from the hesitant individuals. And if you talk to anyone that's hesitant, or even vaccinated people that aren't sure about getting a booster, you'll probably hear much of the same things. And I think that's the end of my section, so I'll pass it back to Dr. Chang.
Thank you, Dan. And now I'm going to turn it over to Dr. Nancy Waite, who is a professor and associate director of clinical education at the School of Pharmacy. And we're really lucky to have her here, because her research program actually examines the very issue we're talking about, which is vaccine use and vaccine hesitancy and vaccine monitoring. So Nancy, I'll turn it over to you.
Thanks very much, Fen. And Dan, what a great talk, and what a great experience. Don't you want Dan to come and do you want to just have him in your pocket, so that when people are asking you questions, he can just give you those very practical answers back? And I think that's sort of what we all want, is that ability to answer some of those questions, ones that we may have, but probably the ones that our neighbors, our families, and so on are asking us as well. So that has really been the goal of our program, program is not only to inform people, but to give them tools and language that helps them explain it to other people as well. And so our program, very similar to what Fen and Dan have been doing within your community, is really to reach out into the community and help understand what are the issues that they're experiencing around vaccines, questions that they have, which have changed over time. I mean, there's no question. We always say, you know, every 2 weeks we have something new that we need to develop in terms of like an infographic or something to explain something, because things are changing. And so that was the goal of our project overall. And let me just go through a couple slides and I'll tell you a little bit more about how, very importantly, how we're doing this, but who we're reaching. So it's called Connect, Collaborate, and Tailor, and it's about multimedia and mainly infographics. And we're going to show you an example at the end, tools, and I'm going to give you a link to the site, and you are more than welcome. In fact, we strongly encourage you to go and get any of these tools, download them, save them, send them to people, whatever helps you, you know, within this space. So, and it's around COVID vaccinations specifically, but we've also begun talking about what about other vaccines, since we certainly know this has changed all of our understanding about vaccines, and we may be thinking about other vaccines now a little bit differently. And we also need to catch up, because we have fallen behind with a lot of the other vaccine programs because of access to medical care, to school systems, and so on as well. So that's sort of the space that we're in right now. Next slide. I have my name up there just because I wasn't sure how we're all introducing each other. So thank you, Fen, for introducing me. We have something called the Public Health Agency of Canada grant to do this. And actually, I'm just one of a number of people who are on this grant to take a look at it. And it's a really mixed group of people. And I think that has been really helpful. We have a graphic designer who thinks very different than we do. We have physicians, we have public health people. We have a lot of community members involved. So that, I think, is one of the things that we have found has been really a big focus of our work. So as I've mentioned, our goal is to develop these multimedia resources, but specifically to collaborate, not only just with healthcare and public health people, you know, we certainly work with those individuals all the time, but to work with diverse communities. And so, for example, we heard about Fen's work in terms of rural communities. That's the kind of thing we want to hear about. What are rural communities facing, trying to understand that we could maybe develop either resources for, or even how do we tailor our explanations of the issues that are currently being discussed, so that it meets and helps you navigate within the rural space, which can be different. And so we have connected with quite a few, we have a number of people who work within the community, you know, nothing related to even healthcare, but are just out there within faith-based communities, within different chat forums. We have kind of a yummy mummy group, you know, of young parents. We have all kinds of ways into communities, but more importantly, people who are in those communities are connected to them and are trusted by those communities, because I can't just walk into a community and expect them to say, oh yeah, you know, you will understand. So it's really been building those relationships and then asking them to help us figure out what's needed. The other part of that, and in fact, if you can go to the next slide, I'll show you a little bit about how we do this, is we do, you know, the big thing is the connections to begin with, but it is about trust. And so, as I said, it's really that collaboration. So it's hearing and listening to what they are saying the issues are, and then working with them as we tailor our products so that we never, oh my gosh, most products go through, I don't even know how many, we haven't counted. I'm sure they go back and forth at least 10, 12 times, because, you know, it's small things about language. You know, at one point we were saying all children need to go back to school. That's one of the reasons why we're really, you know, we need children to get vaccinated. And we had one group say, thank you for saying all. And we're going, well, of course we want all. And they said, no, it was a group of individuals who represent disabled children, and they said they also need to get back, and they're often excluded from discussions. And so that was something we had never, our word, a little three letters meant something to that group that we hadn't realized. And so thinking very carefully about how we use language. I can give you a number of other examples and so on as well, but you really have learned a lot. And this is 2 examples of products that we have, and most of them look like this. So this is sort of one half of the screen there is about our, what we call additional doses, which are different than boosters, and booster doses. And how does it look? And trying to make it sort of more graphic and easy to read and understand. And so this is an example. And then the other one is more on the benefits of vaccinating children. It's a little bit more words, but there are quite a few. But along with that one, because we know that it's not just the parents and guardians that need to make those decisions, but the children also have to be reassured. So we have everything from word searches to coloring pages, other ways of helping explain the vaccine and the importance of being vaccinated to those groups. So much of this has been developed on the basis of parents telling us, can you develop something so that I can explain it to my child? And then the idea of of coloring pages came up. So those all have been developed very, very much in conjunction with these groups. So you'll see there at the very bottom is a link to our health resources. We have, I just wrote down a few of the examples, so, of how RNA vaccines work. So just even understanding the basics about the vaccines and some frequently asked questions. Dan was talking about the myocarditis and pericarditis, and there's one on that. So explaining what it is, and in that idea that, there's some concern about getting with the vaccine, but actually, if you look at the numbers, you're much greater risk if you actually get COVID. And so putting those side by side so people can begin understanding that decision making and having the facts in front of them to understand both sides of that. As I mentioned, quite a bit on children getting vaccinated there. Medical exemptions, that came out just at the vaccine mandate time as to, well, what are medical exemptions and what does that really mean? And why? Because we also want to be respectful of the people who do have very few, but there are valid reasons for not being vaccinated. A lot of other just general ones that are around vaccine decision making, and we're coming up with one on the fertility question as well. So that should be, it's not up there yet, but it should be coming up fairly soon. So that's a brief overview of what we're doing, and so I've really enjoyed hearing this approach to vaccine hesitancy in the rural community. I'm glad that, I'm hoping then too, we can partner even further as people in your community tell us more about what they need. Feel free to feed that back to us. So thank you.
Great, thank you, Nancy. And I'm going to put on our resource slide so that you can see. If you're interested in learning more or have questions or want to access any of the things that we talked about, here is a resource slide that I'll keep on for a while. And so if you're interested in helping to promote the program, you can contact our project coordinator, Sarah, and her email is there. If you're interested in attending a session yourself or interested in becoming a volunteer and attend a training, the links are there for registration. And the web link at the bottom is what Nancy has just been talking about in the resource site at the uwaterloo.ca pharmacy webpage. Okay. So I guess we can go to some questions. I just realized, Nancy, as we were talking that in this full screen mode, I can't see the questions.
Okay.
Are you able to take a look?
I can see the questions. Yeah, well, I can moderate that. So we have one question, which is a great one. I live in Grey Bruce, and if you visit the Facebook communities, there's a lot of anti-science sentiment. How can we combat this, as I believe it's the leading driver of vaccine hesitancy? And it's a great question. And one thing maybe I wanted to say, I forgot to say it before, but I thought it's really important is that I bet everybody on this call is vaccine hesitant. We all along the way have questioned, should I get the vaccine now? Should I wait? What do we know about it? And I don't see vaccine hesitance as a bad thing. I see it as actually a good thing. We're asking questions. We care about what we put in our bodies. We care about being healthy, and we have questions about it. And so I see this as it's very helpful for me when people talk about what is it that they don't understand, or what would they like to know more about, and what are their concerns, because it helps me go to the literature or go out there and listen to experts, and try and understand how can I better answer those questions. So that's the first thing, is I'm not hesitant to listen to those voices. In terms of the best way to combat them, I'll let, I think maybe Dan he's probably heard some of this and might want to comment on it. But I will tell you, there's actually, the first thing I tell people is that very, very few people are anti-vaxxers. Most people are vaccine hesitant and just have really genuine questions. And even somebody who is really anti-vax, who really is very sure this is what they feel, their questions and their comments are still probably things that other people have heard. And so to me, it's important to address their concerns to a point. And if you are anti-government, I have a friend, I will say, who's anti-government, and it probably doesn't matter what I say. In fact, that's our discussion, is that I can't convince that person to trust the government. And so our conversation probably will need to end at some point, because I am answering the questions the best I can, but I can't make somebody trust government or trust science. So I don't take an approach of trying to get them to do that. I take an approach of providing the information that I know, backing it up, and just, people do need to make their own decisions, and I respect that as well. So Dan, what are your thoughts on that?
Yeah, someone that's younger guy, spent a lot of time on the internet growing up. I know from experience that, sorry, am I internet cut out, or?
Now you're okay.
Right. I hope you can hear me now. Okay, right on. Yeah, as a young guy, I spent a lot of time growing up on the internet, and I can tell you from experience that no one has ever been convinced by an argument on Facebook to change their mind, which is not to say you shouldn't try, but your approach has to be really in good faith. And the second it starts people talking past each other. It just becomes basically like a political discussion. No one's going to change their mind by you yelling at another person. And unfortunately, there are a lot of echo chambers on Facebook of people hearing the same things over and over again. And that's why approaching it from a different perspective is so important. You can't fight fire with fire. You're going to have to, if, for example, in these the Reaching Rural sessions, there's no judgment. For instance, you're seeing the people, you're face to face. Even if you're far apart, you're face to face and you see the other person, and you have this kind of one-on-one connection or small group connection. That's almost like a community, I guess. So I think when you're combating it, you can never really do it on like a Facebook page or something like that. You have to have strong community bonds between people. So whether that be just talking to them like your neighbor or something like that, ask questions about it, or speaking, referring someone to this program, for instance, or if you are on Facebook, to talk about it in a way that's non-inflammatory, that respects the fact that they do have questions. And even if someone's anti-science, for instance, I'm sure there's some reason for them to get vaccinated. And anti-science is such a catch-all term that I think you just have to present yourself as more reasoned, more rational, and not kind of explosive. The second it devolves into an argument where people are throwing things at each other, nothing will ever get done there. And the other thing I'll mention too is that when we talk about vaccine hesitant individuals too, all of the things that make them hesitant to an extent come downstream from some of that anti-vax sentiment. They might repeat that information that you make them think they're an anti-vaxxer or something like that. They'll never get it, but they probably just heard about it. And if you kind of address it directly in a meaningful way, and rather than just washing it away and linking them to some news article, that's so much more effective. But I guess as a summary, you can do some engagement, but Facebook is probably not the best place to do it at, and definitely not the best attitude to take while doing it.
The next question that's come in is great. This is something I think we're all facing. As time goes on, we get more and more COVID information, and governments at every level change reaction and vaccination policies frequently. How does the average person keep abreast of good information and not get burned out with endless COVID chatter? Any suggestions? And I'm going to tell you, I took a break over Christmas. Because even I, who's supposed to be an expert, I am tired of it. I am so tired of this being the focus all the time, and feeling pressure as a healthcare professional to keep up on everything. You know, you can imagine a community pharmacist every day walks in and they've changed a policy yesterday they didn't even know was going to change, and they're supposed to be able to answer patients' questions that day. And so it's, you know, it's a challenge. If you're feeling it, others even in healthcare are feeling it too, just so you know, it's not just you. We all have little techniques. So I don't know, Dan or Fen, if you want to share some of the thoughts you have in terms of keeping up.
Sure, yeah. So one thing I find is I never, ever read the media, I guess. You know, there's I think as time has gone on, you know, you've heard the term clickbait. There's always a doom and gloom kind of fear mongering perspective, even from, you know, trusted sources, that the worst possible outcome is always the one that is highlighted. And that's just not going to make you feel any good. When I get my COVID information, I go entirely through to the National Advisory Committee on Immunization, a couple sources like that I can understand. But I try to avoid that kind of spin that you might hear from or sensationalism that you might hear from any media source, because that's just that will burn you out, in my opinion. And I think when I talk to people that are vaccine hesitant and say that, I understand that perspective, feeling burnt out and misled almost by all this endless chatter, then they kind of respond pretty well to that. But yeah, I would say the biggest thing too is kind of take everything you read with a grain of salt, because there always is some interpretation going on there. And if you want to look for resources, we have plenty of available for you that are a bit more reasonable and rational.
I'd pretty much echo what Dan just said in terms of limiting yourself to a few trusted sources versus trying to read up on it all the time and everywhere, because exactly like Dan said, there are so many different resources out there, and some are biased in one way or the other. I say if you find a trustworthy source, and if you're not sure, find perhaps someone you know that you trust in. Right? It could be your healthcare provider, it could be a local, clinic or something like that. But I would say limit your intake, and but focus on the source of the information.
One thing that our group has been trying to do, and it is because we're involved with so many community groups, we hope, I don't know that we're always successful, but we hope that we're hearing the current issues. We actually can turn an infographic around literally within a few days. We kind of 5-6 days is maybe the fastest, but we are fairly quick. So for example, when we had heard through our grapevine that the vaccine for children 5 to 11 was going to become available, we immediately started putting our infographic together. We didn't have all the details quite at that time, so we did as much as we could. And then as soon as the announcement was made and we got further details, we could dig into some sources that the public doesn't have access to. We were able to gather some of the information about the doses and so on, put it into our infographic. So it really was out within probably a couple of days of the vaccine being available for that age group. So I would highly recommend just keep following our source. Also, just try take a look there as often as you would like. And as I said, hopefully we're hitting a lot of the topics that are current. But things change. We're hearing a lot now. Well, why should I be getting a booster, and how does that work, and should I get it naturally? And so that's one thing that we're talking about as an example of a new infographic. So glad to. Anyhow, that's I would suggest finding a couple sources that you understand and that you feel are reliable and sticking with them. And you have to just sort of tune a lot of the other, not tune it out, but just be reasonable about how much you're ingesting, I would say. The emotional fire question that just came up, Jan, by the way, I'll have to ask you if you're related to John Pugsley at some point as well, just because I don't think it's a common last name, but I know John quite well. You know, when you're in Facebook and you've got an anti-vax, how can one avoid feeling the emotional fire?
Yeah, it's a tough one because, like I said, you know, text over text and almost like separate like that. You don't see the other person. It's people just naturally. That's why I would avoid engaging, I guess, on Facebook. I don't want to say that entirely for sure, because maybe some people do get convinced by that. It's so difficult. And I guess if I'm giving you any advice, take a look at it from their perspective. If you're going to link them a resource, probably they aren't going to trust CNN. I'll just leave that there and link them something a bit more reliable that they can look into themselves and be respectful. You know, even if they're not being respectful to you, the more respectful you are to them, well, if someone else is reading that conversation, I think they'll know whose side they go on, not the person that's yelling and screaming. So that's my advice. Sorry, I can't be better. It's just so hard to convince someone on Facebook.
And I'd like to take this opportunity to say thank you so much for such a great session. That was amazing. I wrote down just a couple of key points because I was frantically writing notes, as it is easy to go down the rabbit hole a little bit with vaccines and vaccine hesitancy and trying to argue the point sometimes. I know from my perspective, I learned a few key things. What can we do? We can listen to concerns and answer questions. Sharing accurate information and resources, which I'm very grateful. We'll have some of those to share after the session. You can check out University of Waterloo's website, but also Gateway's website. And we need to be sensitive and be very conscious of the language that we use when we're interacting with folks who might be vaccine hesitant. Provide tools for discussion and address those concerns with respect. I think that's such great advice from all of you. I really enjoyed the session today. I'd like to just quickly say some thank yous to our sponsors. So I'd like to say thank you to CIBC Private Wealth Management, the Jagger, Town Square IDA Pharmacy in Goderich, and the town of Goderich. Also up to all of you, to our fantastic panelists, thanks so much. I'm supposed to be retired and I'm one of those people going, how can I get involved? But lastly, thanks again to all the attendees who joined us today. And we're looking forward to seeing you all at our next lecture series, which will take place on February 1st. So feel free to pass along the information to your networks and expand the reach of these lecture series that we're aiming to promote the knowledge economy, reduce social isolation, and support Gateway's mission to improving health and quality of life of our rural residents. So thank you so much. Stay warm out there and enjoy the rest of your day. Thank you very much.
Thank you.
Thank you, everyone.
Thanks, everyone.